Hi, my name is Evan Rodriguez, and today I'm going to be doing a demonstration on exposure therapy. Exposure therapy is a treatment that's been used pretty successfully to eliminate phobias and OCD in patients, and it works on the theory of behavioral learning and the process of extinction. So today, my friend Luke is going to be playing someone who has a phobia of dogs, more specifically pit bulls. And so his character is going to be someone who's been experiencing some serious anxiety when he sees dogs and serious fear response. And so his fear is so severe that it's affecting his everyday life. He's engaging in experiential avoidance. So basically, he's avoiding things for a fear that a pit bull may show up, even in places where it's not likely to show up, like, Walmart or something like that. And so we're going to basically be introducing him to a pit bull and trying to use extinction on that fear for him. So with Luke, basically what we're going to be doing is introducing him to Athena, our pit bull that we have, and I'm going to be acting as the therapist. So I'm going to try and be trustworthy, but try and take somewhat of a tough love stance. So I'm going to encourage him to eventually go near the dog, pet the dog, and again, this could take a long time, so I'm just going to be trying to encourage him, showing him that nothing's going to happen, and just trying to reinforce any behaviors that he has going towards the dog. So eventually, the hope is that he won't have any more fears of pit bulls or dogs in general, and they won't be able to affect his life in a negative way. The main goal would be to get the client or the patient to live a life uninhibited by their fear or their OCD or what have you, and that's the main goal of the exposure therapy. And so that's what's very important for this in this area. And with Luke, especially my mock patient, his fear would be a phobia, because it's something that's not allowing him to live his life essentially the way that he wants to. So, and that's why these therapies can be exposure therapy can be very useful in this way, because it'll show the patient essentially that they'll learn that this is not something to fear, and it'll have a positive impact on their life because they won't be using experiential avoidance, and so they'll be able to live a more full life and a life that they want to live without being controlled by their fear. Today we're going to be doing a demonstration of exposure therapy and how it could be used to treat someone who has a fear of pit bulls. So this is my friend Luke. He's going to be playing our patient, and so let's get started. So what happens when you see a pit bull?
Well, if I see one, I don't know, I get really nervous. Being around them kind of makes me really anxious. I have trouble breathing. My chest gets really tight, and
Yeah.
I will leave.
So you have anxiety?
Yeah, absolutely. I will avoid them.
Okay. Of course.
I don't go to the park because
you're afraid.
There's lots of dogs there, and if there's one there, I just won't go in the first place, because seeing it is there's too much of a risk.
Okay. So we're going to try and help you with your fear today, and hopefully you'll be a little more able to interact with pit bulls in general.
Alright.
Okay, I'm going to bring the dog near you now. Is it okay to come in the room?
I guess.
Is it okay to get closer with her?
Yeah.
Okay, so this is all about what you want to do, what you're comfortable with. So this is Athena. Come on, Athena. Sit.
Oh.
She's very excited right now, but she's a good dog. She just wants her treats.
Right.
I have some treats for her, so is it okay if we come a little closer?
Maybe stay there for right now.
Okay. Now, do you want to talk to her? Talk to her. Her name is Athena. Say hi, Athena.
Hi, Athena.
Yeah, look at her. She's silly. Alright, I'm going to show you how she eats. I'm going to show her eat her treat.
Oh my god.
Yeah.
That was really close to her mouth.
Yeah, but she's a good dog.
Right. Okay.
All right. Are you ready for us to come a little closer now?
Yeah, I guess.
Okay. All right, we're gonna move a little closer.
She didn't really bite you, so that's
Sit.
okay.
All right.
Okay.
Alright, how are you feeling right now? Are you
I'm
okay?
good.
Yeah, you're okay?
Yeah, I'm alright.
See? Look at her. She's a friendly girl. She's a good dog. She's a good dog.
Sure. She
You
looks.
could touch her. She's very, very focused on her treat. Now, do you think you could come a little closer? Are you comfortable with that?
Oh, she looks at me weird. Okay. Yeah.
Okay. Alright, you think you can come a little Okay, just go at your own pace. Remember, this is just...
Oh.
Okay, Athena, stay. Okay. See, she's not even interested in you. She just wants her treats.
Right. Okay.
Okay, you're gonna come a little closer?
Yeah.
Good, okay. Do you feel comfortable maybe touching her? You could touch her back.
Yeah, maybe like I don't know if I want to go in your mouth.
Yeah, touch her back. See?
Oh, okay. Alright.
Alright, Athena, stay.
Oh, that was...
Okay.
Oh, it's okay.
Yep, she's a good girl. Alright.
Oh, it's okay.
Now, what about you giving her this treat? I'm gonna give it, how about I give it to you to hold for now? And you don't have to do anything with it, but now she's gonna be focused on you.
Oh,
Okay? So you can take your time, do what you have to do. Okay. Okay.
Well, it wasn't so bad.
It wasn't so bad. See, she's a good dog. Remember, you can just go at your own pace. See, she's friendly. You can pet her. She loves pets. I don't have any more treats, baby. She's a good dog. Yeah, there you go.
Okay.
Yeah, she likes people.
Okay.
All right, how about you sit with her and I'm gonna walk out of the room and I'll leave you two alone for a second if she'll stay with you.
Okay. Oh.
Okay. All right. So what I did with Luke is really more like brief exposure therapy. Despite its name, however, it can actually take up to a few hours for a client to become comfortable enough to interact with their stressor as much as Luke did. So he was petting the dog, he was feeding her treats in a matter of minutes, whereas it could usually take people up to a few hours to get to that level. So what ours was basically just a small glimpse of what it would be like. Exposure therapy falls under CBT and it has its roots in behaviorism. The idea is that if you expose a person to their stressor enough, it will become habitualized and they won't fear it anymore or be stressed by it anymore. So it really has to do with learning, and that's what a lot of behaviorism is. Exposure therapy has also been shown to be effective in helping people with OCD and also for some anxiety disorders like social anxiety. So that's all for today, and thank you for watching.